What is up, guys? Welcome to the Trap Jail Nurse podcast. Here we talk about our experiences as current and former SFB jail nurses, the things that make us feel trapped in life, and the practical things you could do to escape these life traps. So we got here today. We got John and we got Rick. What's up?
That's
What's up, everybody?
And so I think today one of the most unknown things is for most people is what happens when you go to jail. You mostly don't know unless you've either been there or you've been booked. And as a nurse, it's not very common. I don't even think they talked about this in nursing school. Did they do that for you guys? Did they talk about correction
No,
in
not at all.
nursing? I didn't even know it
Yeah.
existed as a job unless I heard it from friends and family. So for you guys, how did you guys find? How did you find how did you find this job? I mean, how did you find correctional nursing?
I guess for me, when we went through our psych rotation, one of my professors used to work at the jail.
Hmm.
So I told her a little bit about my interest, or she talked more about like things that you can do aside from the hospital environment. And
Hmm.
then she brought up the idea that she used to work in a jail. So she actually introduced me to the manager at the time. And
Oh,
then the
really?
manager was able to give me a tour of the facility.
Oh, did she used to work there at our place?
Yeah, she did.
Oh,
She was, yeah, my professor was a per diem staff.
oh, okay.
So I think that was probably the reason why I got the job. Like even as a new grad, like
Uh-huh.
her recommendation had a lot of weight, I guess, because she was well liked at the job or at the jail.
did you ever get a chance to work
Okay.
with
What
her?
about you, Rick? I know. Did we work
No,
with her too?
I never did. I think she must have worked there like years before.
Uh,
Oh, okay.
Yeah, but she still knew like the manager. And they were very familiar with each other. So I think they made the connection real quick or really easily, and then that allowed me. That was my in basically.
Okay. Yeah. I mean, it's not very common to hear about jail nursing unless you know somebody that is either doing it. That's usually the only way that you find out. Because for the most part, when you go through nursing school, you talk about the hospital, which specialty you're going to go into. And I think, yeah, you do psychiatric nursing, but corrections by itself, it's a little bit lesser known. And
Hmm.
so for you, Rick, how did you find out about it?
actually, I found out from one of our former classmates when we went to, and she basically told me that the jail was hiring, and that
Uh-huh.
I obviously had my doubts first, because I mean the only thing that I knew about, or what I thought I knew about the jail, was whatever was on Orange is the New Black, and
Yeah.
whatever A&E had on TV for whatever happens in the jail. So that's all I knew
Yeah.
what happened in jail. So I kept asking, well, is it safe? Is it safe? And she seemed to be okay with it. And I said, well, you know what? If she could do it, why not me? And it turned out to be a good
Mm.
decision.
I mean, that is true. I think when most people talk about the jail, the immediate question is it okay for you to work there? Whether you're a male or a female, safety is always an issue. But before you started, after you applied and stuff, uh, I know you mentioned the Orange is the New Black, and I want to say at the time, that was my reference as well. Like, that's the only thing I knew about anything corrections related. Um, and so, what did you know about the jail before you came in? Like, did you know anything? Because I personally didn't. I didn't know what I was getting into.
I honestly didn't. I mean, everything kind of starts off with, did you ever watch Cops on TV before, where you see a person get arrested?
Yeah, I
All
think, yeah.
right, so
Yeah.
there's that portion, and then you see Orange is the New Black. So I mean, there's a total disconnect. There's a lot of stuff that actually happens from the whole Cops part, and then to is the New Black thing, and I had no
Yeah.
idea.
Yeah, for sure. That even though I my professor used to work there, I still didn't know like what the nurses actually did. Even after taking the tour, like I knew how the layout was and a little bit about the roles, but you really don't know exactly what the nurses actually do, like for that entire whole shift.
That is true. I mean, you even read the description, like job descriptions for any of the correctional nursing or jail nursing, and it still made zero sense to me.
Hmm.
Yeah,
I was like, I don't know exactly what I'm doing. Like, well, what am I supposed to do? So I think that is pretty common, but it's actually
yeah,
not as bad as most people would think. And I think safety is another thing that we always talk about. And I personally feel like it's really safe in the jail. Like it's safer than most places that I've been to.
hmm,
Like I worked at the locked facility that Rick worked at years before me. I think a few years before
Hmm.
me, right? And compared to that, it's way different.
hmm,
But I think for our audience, it's not very common to know what exactly happens unless you've been booked. So I think it would be good to talk about that. So, like, one of the first things that happens when somebody gets arrested is they come through us to get screened before we say it's okay for them to be housed or for them to stay. Because our main goal is to ensure the safety of the patient, which is the arrestee. And so that is our intake process. And did you guys somebody want to talk about that or kind of discuss the process?
I mean, usually you guys kind of get started with their medical history. If they have any past medical history that's kind of pertinent to helping you have the continuation of care. And then for the area that we were at, there were a lot of um, drug use patients
Hmm.
that
That's a
would
pretty
come
common
in.
one.
And so essentially, again, safety is basically the number one thing. You don't want to cause problems for later on when they end up getting booked, or if they end up getting booked and going up to one of the floors, or as they call it, the pods. And so you do a lot of preventative measures where if they're an alcoholic, you want to make sure they don't withdraw. You want to know how often they're drinking, what kind of alcohol they're drinking. Um, I mean, it seems to be that that's actually kind of some pertinent information, the type of alcohol they drink. Also, want to know what kind of drugs they're using. Are they on opiates? Are they on, or are they using any benzos? And definitely
And what are benzos, Rick?
those medications that calm you down.
Oh, yes, yes. Typically used for anxiety, short for benzodiazepine. Just the drug class, but I think the most common one for that is what? I mean, we use Librium,
Ativan. Ativan's
Ativan.
Ativan,
definitely one of the
common
common
one.
Yeah,
ones.
that's a good one.
It's basically like a sedative,
Yeah.
Yeah.
but it could be used for a lot of different reasons.
Yeah, so when somebody comes in, main thing is we just want to make sure that they're safe, they're okay, and we are typically responsible for everything health related. So, I mean, nobody's excluded from having disease or from having a medical issue. So when you come in, we still take care of it. You won't be neglected. That's never our goal. If you have diabetes, we'll help you with that. You'll get finger sticks. You'll get all the medications that you typically get outside. Will continue if you're staying with us. And even if you're not staying with us, if there's something that you need that's immediate, we try our best to continue that for sure. And so I think that intake part is probably one of the most interesting ones.
Yeah, for sure.
I mean, you see pretty much everything there. There's a lot of stuff. I don't even know what you don't see.
Yeah, if you're looking for like the most action-packed part of the job, that the intake part is definitely it. One
Yeah.
thing I wanted to add to what you guys said is basically the intake stage is what we're basically doing is just triaging the incoming people for anything that might be like an emergency. So there's really three main like categories that people can come in. when they come in or they get arrested into the facility. So they can come in and be having some kind of true medical emergency, which would require them to be rejected and then be sent to the hospital first for clearance. The next one would be if they didn't have any medical problems at all. And then what most people end up being classified under is, they have some kind of medical problem, but it's not an emergency, but just needs some kind of follow up. So,
Oh
like
yeah.
if they have asthma or high blood pressure or something like that.
Yeah, typically
So,
the chronic illnesses, I mean, we're going to handle them. We'll ensure that you get the care that you need for it. So that's not typically an issue. Like that's okay. That's easy to handle.
I feel
mm,
like one of the really important
And
things for the intake process also is your ability to help de-escalate situations also. Mind you, that is like
oh yeah,
the
how
biggest, um, usually that's going to be one of the worst parts of someone's life is being arrested and going through that process. So,
yeah.
that
Like
is
I
true.
don't know if you guys, our audience, has heard about the story of the Tesla going off the cliff in the Bay Area, but they initially thought that it was an accident, but
Oh
it was
yeah,
a
the
it was a
guy, right?
doctor who drove
Uh-huh.
his family off the cliff. So that guy is going to get medical care first at the hospital, of course, but eventually he's going to come through the jail
mhm.
system, right? So their mindsets are already they're already under like a ton of stress, and we don't know how they're going to act. Sometimes they can act
That's
pretty
true.
crazy.
And so that's another thing also. When people come in, typically, how are they presenting? Are they very happy to be in that situation?
Some
When they
people
see
It
you and talk
depends.
to you?
are. Some people are.
It depends.
It depends on how often they come in too, I think. If they're like
Oh,
a
that's true.
regular.
That's
Many
true.
Yeah.
times a lot of the people, or a lot of the people that come in, they could be transients, and at times it's super cold outside, just kind of like right now. It's we're kind of bundled up. It's super cold outside, or it's
Mm,
raining. It usually depends sometimes on the weather outside. That'll depend on how
Hmm.
your night is going to be at intake.
Hmm.
The full
That
moon
makes sense.
too.
That makes sense. People start coming in.
mm.
Yeah, the full moon. I don't know about the full moon, but it does definitely happen. I don't know what it does to people, but it's definitely affecting
Yeah,
something.
I remember going out when I used to work night shift. I would go out and just to see if it's a full moon, just to mentally prepare myself before going to work. Like, oh man, here we go.
And so another thing with that too is when they come in, how willing are they to talk to you? Because I don't know if they have an idea of it, but a lot of them think that we're going to add to their case or to their whatever they've been arrested for. So how do you guys usually respond to that? Most of the times they're going to tell you like they won't talk to you straight up. They just don't want to say anything because they
Yeah.
they think if they answer your drug questions that it's going to add to their charges or whatever it might be.
Yeah. It just depends on the person, I think. A lot of people come in and like they might be really angry and they don't want to talk to anybody, even the medical staff. That's pretty
Hmm.
normal. And then the drug question that comes up is a common one. But it really depends. Like I think once they start to show like resistance to answering the questions, well, at least what I used to do was I would explain to them that it's really just for their medical records. Like it's not something that we were going to share with custody, and it's not something that is going to add like another charge to the records if they took a drug or something like that. So I think most of the scenarios that came up where there was resistance, like after you explain that to them, they start to get more open. But of course, there are people that basically say, I don't want to talk, or my answer is no to everything. And that's just part of it.
That's a very fast intake, by the way. When
Yeah,
when they say no to everything.
it is. Yeah, I think my fastest intake was maybe like 2 minutes when we used to be on paper.
Yeah.
Oh, that's
Once you
true
do,
for the
yeah, once you do it
I don't
over
know.
and over again, yeah, you can get it down pretty fast.
That is true. I think everybody did it on paper at
Yeah.
one point, right?
Hmm.
Everybody
Yep.
here?
Most
Yep.
definitely.
Yeah. So. I don't know how common that is for most of our audience, but there was a time when we did paper.
Yeah, we were on paper a long
Paper
time.
charting.
I don't.
That is true.
Yeah,
That is
we.
true. No names for the facility, but yeah, we were on paper for quite a while. I think the only thing, you're not going to get in trouble if you tell us your medical history, but I think the one thing is when they tell us they got something in them. You guys have had that before, right? Where they stow away or they shelf an item,
Oh yeah,
which is
we should tell. We should tell them what they do before they get
What
to
is
us.
shelving, Roland?
shelving. Okay, let me try to explain it. So I can't draw it out and I can't show you, but your rectum is it's a cavity, and I believe they store items up there. It could be anything really. It could be paraphernalia, it could be drugs, which is the usual case.
Oh, it's like a
But
pantry.
yeah, it's like a
Literally like
pantry.
a shelf.
You just like place it in there, and then it just stays there for a while. But the danger with that is, like, let's say it's just a substance they wrap with, I don't know, saran wrap. I don't know what they use to wrap it. But if it breaks, your rectum is it's just a whole mucosal layer, so it's going to absorb everything.
Yeah.
And then when that happens, you do a body scan, and when they find the body scan, what do they usually do, guys? That's my that's my favorite one. They put you on, either you get sent
You
out,
usually
right?
get
Don't you get
sent
sent out,
out,
or you go on a potty
or they
watch?
go on what they call a potty watch, where
Hmm.
And what is the potty watch,
essentially
Rick?
they place you in a cell and they monitor everything that comes out of the body, essentially.
Ah, I see. And when something does come out of the body, are they able to
They are
flush it?
not able to flush it. That is to be inspected by the custody staff prior to
That is
anything.
correct. So no shelving, guys.
We should tell people that the inmates do get searched before they even get to that point. So
Oh,
they've
that is
Usually,
already,
true.
yeah, before they even get to the intake nurse, they've already actually stripped down entirely naked, and they've bent over and coughed to see if they actually have something hidden in their cavities. So they've already been
Hmm.
searched once, but sometimes things get through. So that's what this
That is true. It could be
search
really
is.
high up there. I don't know what the hell they do with it.
Yeah.
that
But yeah, it's not
I
uncommon to
believe there
hear
were
that.
some
Mhm.
that, you know how some people have weaves? They are able to kind of hide
Hmm.
it in their weaves also.
Mm.
So that,
Oh, like
yes,
in their hair? I think I've
yeah,
seen that.
that's
Yeah,
one of the other things
that
that
one.
I've seen. There's one guy that had come through intake. Supposedly he was already searched by the cop, but when he got searched by our guys, they found a whole, I think it was a Jim Beam, a whole big Jim Beam in the guy's pant leg, and one.
Oh, I thought it was somewhere else. I couldn't imagine it being
Yeah,
anywhere
In
else.
his pant leg? Oh, wow.
but
I think, yeah, I've seen. I mean, I've heard of things like that before.
Yeah.
Oh yeah. I mean, the intake portion is a pretty thorough process. And if you're a nurse, for the most part, you're just responsible for their health.
Hmm.
You shouldn't be concerned with their case, although you have access to it. It's not exactly going to help determine anything, and it's not really anything
yeah.
useful to you unless you know that it's like for drugs or something. So then you could ask about withdrawal or any questions pertinent to whatever specific drug that is.
Yeah.
And so, yeah.
The hard part
What do
with
you think the most? Oh,
with
go
our
ahead.
intake was we only had we only had one intake nurse. I think a lot of
Oh,
bigger facilities they actually have several. So at least for where we worked, that was kind of like a choke point when people came in.
mhm.
So if you had like five people waiting outside who got arrested, they all need to get cleared by this one nurse. But I heard a lot of other jails, they actually have several intake nurses going on at the same time. So I don't think they have
Mhm.
that same problem.
Actually, going back to that question where you said, how they are with answering your medical questions. Yeah, there are
Hmm.
people who don't want to answer any of your questions or any medical questions, and it's usually the way you present the question to them or present yourself to them in a sense, like kind of give them some education behind why you're asking these questions, just because
Hmm.
maybe
Oh.
they have a medical issue and you're going to be the one responsible for them. You want to be able to help them out should
Hmm.
something happen. You want to know what they're allergic to, what their medical history is, so then you can make adequate decisions on how to help them.
Hmm.
However, even though we have people who don't want to divulge information, there are people who would over divulge information. Um, a lot
That
of
is true.
these, yeah,
It's
a
like a
lot of
story
these will
time.
just tell you that they're on all the drugs under the sun.
Those are actually
True.
the more difficult intakes too.
Yes,
Yeah, those are harder than the people that actually like don't want to share anything.
And
that is true. The ones that are allergic to Tylenol and Motrin, and the only thing that works for
is
them is a narcotic
Yeah.
of some sort.
I've gotten one where they said they're allergic to Tylenol and Motrin, but they can only take Tyco or
Uh-huh.
Tylenol with codeine. So I'm
Oh
like,
yeah, I've seen that.
are you allergic
Yeah,
to it or
Does
not?
make me
yes. This is unrelated, but were you guys there when somebody had said they're allergic to the sun, so they can't be released
Oh,
during the day?
I have not heard of
no,
that.
I haven't
I
heard of
could
that.
not. I mean, that came in as a like a medical request. They straight up said that they can't be released during the day because they're allergic to the sun. And I was like, how have you been surviving rec time, right?
Or just surviving life in general on the outside. They just
Yeah, the sun is 20, well, not 24/7, but it's a good part of the day for sure.
wow.
Yeah, so I mean,
Have you guys ever? I'm sure all of us have done it, but have you guys been brought to the Sally Port or Sally Port is where the cop cars come into the jail? But have you guys had to go out there to do a jail clearance, like from the back seat of the car?
man, that's only when they're uncooperative or they're like wrapped up. That's usually a pretty difficult portion if you have to go outside to do that.
Yeah, those are another part of the job that's really hard. It doesn't happen too often, but sometimes you do have to try to clear them, or the officers want you to be able to clear them while they're still in the backseat of the car, which is like super
That's
awkward.
true. I think it's good for the audience to know also, like, let's say you're a nurse and it's like you're doing all this work in intake, you're doing assessments on people, but I don't know if I can speak for all the like facilities and stuff, medical instruments that you're using. It is, I wouldn't say you have a lot of them. You have all the good basics, I would say. So your assessment when you're doing that stuff has to be on point
Yeah,
for sure.
definitely. I mean, I've
Yeah.
seen some people bring their own thing. Like, I know that JR,
Yeah.
he will bring in
Anything that
his
helps.
own equipment as well. And he'll bring his own manual blood pressure cuff, and it's it's actually interesting what he comes to work with because he's all set. He's set up really good. He has his own pulse ox. He has, I mean, yeah.
Man, that is good. Oh, here, real quick, quiz time for you two. This is off script. It just came to my head. But when using a manual BP cuff, are there are there odd integers?
I don't think so.
I'm glad that you brought that. Yeah, I
I
don't
don't think
think
so.
so because I think one time I said like someone's blood pressure was 121, and then someone called me out and said, "Wait, no, that's not possible."
So on a manual blood pressure cuff, typically they don't have the odd integers. Every tick mark on there should be something even, ending in a 0, 2, 4, 6, 8, whatever, 10. Or yeah, so that's just another fun fact, I guess. That just came into my
You
head
pay
right now.
attention to that stuff?
Okay, Ah, man, I don't know. I don't know. I came in. It could have been this.
Oh,
It could have been
nice.
because of this. That's why.
That must be some really good milk.
It is. It is. It's a nice 25 ounces of good milk. But I think that's a pretty good like brief discussion of what you do in intake. As a nurse, you're gonna do your assessments when they come in. So it's just health assessment. It's a head to toe for the most part, as much as you could do, and you handle anything immediate or urgent at that point. And from there, the inmate typically will. Okay, not. Are they called
Mm,
inmates already?
I
Once they
think
come in after we
so,
clear them?
but we also do kind of a really brief mental health assessment as well.
That
Oh
too,
yeah.
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 That's a good addition. So we cover everything. I believe you could even call it holistic care. Is that holistic already? If I'm talking about mental health care.
I'm glad you brought that up about the
But what?
mental health assessment because after they, if they get cleared by us to come in, there's actually a couple different directions they can go. And if they are like
Really?
suicidal or actively suicidal, then they'll be going to a very specific place right away.
Yeah.
Mm-hmm. It is one of the coldest areas in the jail, I believe. It is one of the.
Yeah.
Um, but yeah, that could be another discussion too. Just for that. So from intake, once they end up getting cleared by us, there is a possibility of them either staying for a little bit. Maybe they need to sober up and then they leave. That's pretty typical for those that are under the influence of alcohol. But if they end up staying with us because they have a more serious charge, they end up getting housed. And by housed, it means they go from our ground floor up to a different floor, which houses. I mean, I guess I can't say in general how many people they would house, but they house a lot of people.
Hmm.
So that's where they're going to be staying until they see, I think until they go to trial, correct? Isn't that how that
Pretty
works?
much. Yeah. They either waiting for
And
trial
so,
or that's where they, if they were just carrying out their sentence, however long that is, that's where they'll be doing their time.
and so when they go up there, the care from us doesn't stop. We're still going to handle any chronic illnesses you have, and if you have any acute issues, that's another time that we're going to come see you. So this is a separate role. If you're doing intake, you're just doing all the people that come in. But if you're upstairs and you're handling the people in the housed areas, then you'll be doing things along the lines of triage, house calls, and any, what would you call it? You know, everything
What's a
for the
house
chronic
call?
illnesses.
Just kidding.
You'll be doing that. Oh, yeah, I forgot. I don't know, is that language okay? Or is that fitting for
House
us?
calls. House call is
No,
basically any
I said,
call
what the
from
hell was
the
that called?
pods with any medical complaints from the inmates. One thing I wanted to add though, Roland, like the triage or the intake nurse can actually be doing all those things too. Uh, so
Oh, that is true.
while
That is
the
true.
inmates are
Everybody can.
at that intake area, we don't know how long they'll be there, but while they are in that area, at least for the facility that we worked at, the intake nurse was responsible for like whatever they needed in that area. So if they need to get meds,
That is true.
if they need to get like vital sign checks and stuff like that, those were things that intake nurses were doing in addition to processing the people that were coming in.
Yeah.
That is true. You get a lot of care down there. I mean, even if you're there for 1 hour or 10 hours, anything that you need medically, that
Mhm.
we're going to be able to cover that. Like, we'll be able to help you with it at least. That's the word that I like to use is help you.
Yeah.
But then moving from there, we end up getting people that get housed. So they go upstairs, they go into a pod. For us, it was anywhere up to like, I feel like it was 96 people was the max up there on one floor, or at least on one little housing
Hmm.
unit. And then that's another thing because you have a whole set of nurses that are responsible for everything beyond intake. So if you're not doing intake, you're handling all the chronic and acute issues that might arise from a housing unit. So as one of those, what do you call them? Like a staff nurse? Would you
Yeah,
just call it
sounds
like a
right.
regular? What assignment is that?
Yeah, I guess.
There's quite a bit of things that you end up doing. But if you guys could talk about what you're responsible for the people that end up staying there for more than a few days, up to a few years,
Hmm.
actually.
Yeah, I can probably add to that. So aside from intake nurse, you'll always have a charge nurse on the shift. Um, One of the other primary duties of the jail nurse is to administer meds. So you'll have a medication nurse. Depending on the shift that you're on, there might be a triage nurse that is just handling all the sick. We call them sick call slips. So whenever an inmate has some kind of medical complaint, they'll put it in writing and then submit it for a triage nurse to review. And what other roles are those the main ones? I think they are. So we have medication,
Yeah.
triage,
Hmm.
charge, and intake. Those are really the primary duties. Sometimes we'll have like support staff that will kind of float and help those other people, but I think those are the main ones.
Yeah, pretty much.
Yeah,
I mean,
that's true.
there's no dedicated wound care nurse, except for when you guys were there. You guys, the behavioral health
Um,
people, were the wound care nurses, the dedicated wound care nurses. But yeah,
that's true. But I think in general, everybody's capable of doing it. Um, so
mhm,
it depends on your facility. But for the most part, like what John said, those are the main responsibilities, in addition to what Rick also
Hmm.
added. So you handle pretty much everything, but depending on your facility as well, you might have more or less people. But for us, that was in one facility we had at a certain point it was like 501 facility, wasn't
I
it?
don't
Before COVID?
remember.
What was the max people you mean?
Yeah, because if it was like 96 per
We've
floor,
had,
and we
I
had
think our building capacity we used to be 1,000 inmates, and we've been maxed out before.
in one
Yeah,
facility.
when we used to be just like a single jail. I mean, uh, yeah, we've been at
Oh,
max
okay.
population before.
Did you work at the old one?
I did, yeah,
The
yeah,
old one?
Wow,
yeah. So we used to, or
That's when they had
I,
like the analog
like you're
central
OG,
control.
man.
I think. Wait, are you talking about the old women's facility?
That one and like the old county facility where the courts were.
Oh, like they call it. Yeah,
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 anyway.
yeah. It's just another building. We've been at max before, so basically, it's a team of, you know, depending on the jail, it's a very small team of nurses that are responsible for
Hmm.
maybe a couple hundred, couple thousand inmates, depending on the jail size,
Yeah.
and they're responsible for pretty much everything. So, I think the best analogy, to, at least with like MedPass, would might the closest thing might be like a nursing home, like where you might have to pass. There's one nurse that has to pass meds to maybe 30 or 40 people. But in our case, it's like one nurse might have to pass meds to maybe a few hundred people, and it sounds really bad, but actually, once you start doing the job, and you get to know like the meds and what kind of meds people take, then it's a lot easier than it sounds like.
When you guys did med pass as a new nurse, how often did you need to know? I mean, that sounds bad. But you pass thousands, not thousands, but you pass hundreds of meds for sure. And so could you say as a new nurse that you knew exactly every single med and what they do and why they're taking
No,
it?
not at all. Of course not.
That's
No.
impossible.
It's common.
Yeah.
When you're new, the inmates know that you're new. And I mean, I don't know if they're just messing with you or if that's just like a thing. But they're
Yeah.
gonna ask. Like they're gonna ask like, "Oh, what are my one of 10 meds
Hmm.
for? What is that called?"
Yeah. Well,
So, I mean, it is important to know
I,
it
I
for
can
sure.
say
At a
I can
certain
say for
point, you
sure that after doing the jail job, and how much medications we had to pass,
yeah.
we got I got like very very good with meds after that. At least just recognizing right off,
Yeah,
like if somebody told me the name of medication, we would know kind of right off the bat what it was for. But that was after
yeah, because
having to
like
pass so many meds.
They would ask you on the spot, and then you have like how many other people just listening. And if you can't identify the medication
Mm,
that you're giving, how does that instill any confidence in anybody else? Like, oh, he could be giving me anything. Like he doesn't even know what he's giving me. Like you feel
yeah.
weird. Like
Or if they say, "Oh, you gave me the wrong pill," like this looks like 600 milligram. It should be 800. So being able to tell just like the difference
yeah,
between how pills look
Yeah.
too.
At some point, you actually start reading
that too.
the numbers or looking at memorizing the numbers on pills as well.
Yeah.
That's true.
When I
That's true. You're like, oh, you see a three? That's a typo
yeah,
right there.
when I started at the jail, I actually did a med pass. All I did was med pass as an RN for a whole year.
I think most of us, yeah, most of us start like that because you got to get familiar with all of those for sure. I mean, that's like one
Mm,
of the foundations of it because you do med pass if you're working in the evening. You'll do med pass like
It
at
mm,
least
helps you get
twice.
familiarized with the jail too, or
So you better get
with
used to
the
it.
people there, the jail, and the inmates that you're going to be seeing when you do other
yeah.
jobs, like if you're end up being a float nurse or whatnot. It kind of gives you like a brief summary of what's going on with the jail when you do a med pass as a new.
I think it'd be useful
That's true. What
to
do you?
tell people what like the med nurse shift looks like too. Like how can that take up an 8 hour shift? And this was when we used to be on paper, but basically because we had to give meds to like 200 300 people, you would have about 3 hours to prep the meds, maybe 3 hours to pass the meds, and then the last 2 hours would be like kind of miscellaneous. Might be doing other
Charting the
things too,
meds.
Oh,
or charting
charting,
Yeah.
too. Yeah,
charting.
but that was when.
And if you chart on paper, man, my
Yeah,
hand, my hand would
yeah.
be
Yeah.
cramping. I started out with my initials as like maybe it was like three letters, maybe it was my whole last name. I don't know. But then it just got shortened down to one letter,
Eventually, mine
and it was
just
like a little
came
squiggly
down to
line.
just one stroke. It wasn't even the full letter. It was just like like it was like a shape. Like I knew it was my name, but
They're like, "Is that a check mark, John?" Like, no, that's not a check mark. That's my name actually.
but that was yeah, that
Yeah,
was before on
it's
paper
back
though.
then. It's
Yeah,
prehistoric times.
but even on electronic,
Back in the 1900s, I
even
would say.
electronic takes. I think it still takes like we still get about the same amount of time
It
to
takes a
do all
long
that,
time.
even on electronic.
Mhm. Yeah, definitely. Because I mean, when you're doing meds, you're packing pills, you're doing tablets. You even prepare liquids. It could be
The
creams.
shots too, the
Hmm.
IM shots.
Oh yeah, IM shots. You'll be responsible for that, so you have to take time and prepare for that as well. Have you guys done like IMs through the ports?
Yep.
Yes.
Yeah.
Have you guys ever done that? That one's
Oh, we should
interesting.
explain that part more too. So like
Oh, that's
on the
true.
pods when they actually administer the pills, sometimes when the nurse goes onto the pod, they might just stand somewhere in the middle, and then the inmates would come up to you. Sometimes you have to visit each cell at the door, and sometimes they'll open the door, but sometimes they keep the door closed. So the only way to give the medication is through there's a food port on the door where they give the food trays, and that's where you would give the pills. And sometimes you have to do an IM injection through that port.
I know. That is one of the most unique situations, I would say. I don't even know if we should be describing it like this, but I mean, like they put their butt cheek up against the port, and it's like